Brainstem. The brainstem is the stalk-like part of the brain which connects the spinal cord with the forebrain. From below upwards it consists of three parts: medulla oblongata, pons, and midbrain. The midbrain is continuous above with the cerebral hemispheres and the medulla oblongata is continuous below with spinal cord. Brainstem is located in the posterior cranial fossa. Its ventral surface lies on the clivus. Posteriorly, the pons and medulla are separated from the cerebellum by the cavity of the fourth ventricle. The brainstem, like spinal cord, consists of nerve fibers and nerve cells. Most of the nerve fibers in the brainstem are arranged longitudinally in the form of tracts as in the spinal cord. But the nerve cells of the brainstem do not form a single central mass of gray matter as in the spinal cord, rather most of them are aggregated to form the well-defined nuclei. In addition to the well-defined tracts and nuclei, the brainstem consists of diffuse system of nerve cells and nerve fibers called reticular formation. The central canal of spinal cord continues upwards in the lower part of the brainstem and then it widens and moves dorsally to form the fourth ventricle. The brainstem serves the following four major functions. It provides passage to various ascending and descending tracts that connect the spinal cord to the different parts of the forebrain. It contains important autonomic reflex centers, vital centers, associated with the control of respiration, heart rate and blood pressure. It contains reticular activating system which controls consciousness. It contains important nuclei of the last 10 cranial nerves, i.e. IL to ZIL. NB. The bilateral destructive lesions of the brainstem are fatal because of damage to vital centers which control respiration, heart rate, and blood pressure. The impairment of reticular activating system leads to progressive loss of consciousness, followed by stupor and coma. The medulla oblongata is the direct upward continuation of the spinal cord, extending from foramen magnum to the lower border of the pons. It forms the lowest part of the brainstem and lies almost vertically in the anterior part of the posterior cranial fossa between the clivus, superior surface of the bassi occiput, in front and the vallecula of the cerebellum behind. The medulla is shaped like a truncated cone, bulb-like, hence its alternative name bulb, cf. bulbar paralysis. Medulla oblongata measures about 3 cm in length, 2 cm in breadth, at the widest part, and 1.25 cr in thickness. The medulla contains vital centers which are essential for life. These are a. Cardiac center, b. Vasomotor center, and c. Respiratory center. Medulla provides attachment to last 4 cranial nerves. The lower part of the medulla, like the spinal cord, contains the central canal. In the upper part of the medulla this canal widens and moves dorsally to form the lower part of the fourth ventricle. Thus, the medulla is divided into a lower closed part and an upper open part. An overview of structure and components of medulla and their functions is provided in Table 8.1. Table 8.1. Structural components and functions of the medulla oblongata. Clinical correlation. Since the medulla contains vital centers, an injury to it is usually fatal. The respiratory center is particularly vulnerable to compression and poliomyelitis with subsequent respiratory failure. The bulbar paralysis is characterized by the paralysis of muscles supplied by last 4 cranial nerves arising from the medulla. External features. The medulla is divided into right and left symmetrical halves by anterior median fissure and posterior median sulcus, Fig. 8.1. The anterior median fissure is continuous below with the corresponding fissure on the spinal cord, and above it ends into a small triangular depression called foramen caecum, at the lower border of the pons. It is interrupted in its lower part by the bundles of fibers crossing obliquely from one side to the other, the decussation of pyramids. The posterior median sulcus continues below with the corresponding sulcus of the cord and is present only in the lower half of the medulla. Above its lips diverge to form the boundaries of a triangular area, the lower part of the floor of fourth ventricle. Each half of the medulla is marked by 2 sulci anterolateral and posterolateral, which are direct upward continuations of the corresponding sulci of the cord. The anterolateral sulcus extends along the lateral border of the pyramid and along it emerges the rootlets of the hypoglossal, cranial nerve. The posterolateral sulcus lies between the olive and the inferior cerebellar peduncle and along it emerges the rootlets of glossopharyngeal, X, vagus, X, and accessory, cranial nerves. The anterolateral and posterolateral sulci with nerve roots divide the surface of each half of medulla oblongata into anterior, posterior and lateral regions like that in the spinal cord. Features on the anterior, ventral, aspect of medulla, Fig. 8.1. The ventral aspect of medulla presents following features. Pyramids. These are two elongated elevations, one on either side of anterior median fissure, and are produced by the corticospinal pyramidal fibers. Most of these fibers, about 75%, cross to the opposite side, pyramidal decussation, in the lower part of medulla, and then descend as lateral corticospinal tract in the lateral white column of the spinal cord. About 20% of uncrossed fibers run downwards as anterior corticospinal tract in the anterior white column of the spinal cord. The remaining 5% run downwards along with uncrossed fibers in the lateral white column of the spinal cord. Fig. 8.2. Olives. These are oval elevations, posterolateral to the pyramids, and are produced by an underlying mass of gray matter called inferior olivary nucleus. Rootlets of the hypoglossal nerve. These emerge from the anterolater al sulcus between the pyramid and the olive. Inferior cerebellar peduncles. These are thick bundles of fibers lying posterolateral to the olive, and attach the medulla with the cerebellum. Rootlets of the 6th, 10th, and 5th cranial part cranial nerves. These emerge through the posterolateral sulcus separating the olive from the inferior cerebellar peduncle. Features on the posterior. The dorsal aspect, the medulla is well demarcated into lower closed and upper open parts. Features of the closed part. The closed part, on either side of posterior median sulcus, presents three longitudinal elevations. From medial to lateral these are fasciculus gratulus, fasciculus cuneatus, and inferior cerebellar peduncle. The upper ends of the fasciculus gratulus and fasciculus cuneatus expand to form the gracile and cuneate tubercles respectively due to underlying nuclei of the same name. Another elevation present lateral to cuneate tubercles, the tuber cinereum, is produced by the spinal nucleus of trigeminal nerve. Features of the open part. The open part of the medulla forms the lower part of the floor of fourth ventricle, which presents number of features like median sulcus, hypoglossal and vagal triangles, vestibular areas, area postrema, stria medullaris, etc. Fig. 8.3. For details see floor of fourth ventricle on page 122. Internal structure. As in the spinal cord, in the medulla also, the white matter surrounds the central mass of gray matter, but in the latter, the gray matter is broken up into nuclei that are separated by nerve fibers. The internal structure of medulla is well appreciated by examining its transverse sections at the following four levels. At the level of decussation of pyramids. At the level of decussation of medial lemnici. At the level of the olives. At the level just inferior to the pons. Transverse section of medulla at the level of pyramidal decussation, the great motor decussation. The section at this level passes through the inferior half of the medulla, and closely resembles to that of spinal cord. However, following important features are observed at this level. Fig. 8.4. The nucleus gratulus and nucleus cuneatus appear as the narrow strip-like projections from the posterior aspect of the central gray matter. The apex of posterior horn gets swollen up to form the nucleus of spinal tract of trigeminal nerve. It is an upward continuation of the substantia gelatinosa in the posterior gray column of the spinal cord. The spinal tract of trigeminal nerve is a bundle of fibers which caps over the nucleus of spinal tract of trigeminal nerve. Decussation of pyramidal tracts forms the most important feature of medulla at this level. About 75% fibers of pyramidal tract run backwards and laterally across the midline to reach the lateral white column of the opposite side of the spinal cord, where they run downwards as the lateral corticospinal tract. In doing so, the anterior horns are detached from the central gray matter. Each detached anterior horn divides to form the spinal nucleus of accessory nerve and supraspinal nucleus of first cervical nerve. The nucleus of accessory nerve extends downwards up to fifth cervical spinal segment. The supraspinal nucleus gives off the efferent fibers of the first cervical nerve, and is continuous above with the nucleus of the hypoglossal nerve. Appearance of diffuse zone containing a network of fibers and scattered nerve cells within it. The lateral white column adjacent to nucleus of spinal tract of trigeminal nerve is called reticular formation. Transverse section of medulla at the level of sensory decussation. This section passes through the middle of medulla and displays following features. Fig. 8.5. The nucleus gratulus and nucleus cuneatus become more pronounced and are separated from the central gray matter. The fibers of fasciculus gratulus and fasciculus cuneatus occupy the broad posterior white column and terminate in these nuclei. The internal arcuate fibers arising from the cells of gracile and cuneate nuclei, second-order sensory neurons conducting sensations of discriminative touch, position and vibration, course forwards and medially around the center al gray matter and decussate with corresponding fibers of opposite side in the median plane, sensory decussation, and then turn upwards to ascend as the medial lemniscus on the opposite side close to the median plane. In this decussation the gracile fibers are medial to that of cuneate fibers. The internal arcuate fibers cut off the spinal nucleus and tract of trigeminal nerve from the center al gray matter. As the fibers from nucleus gratulus and nucleus cuneatus pass forwards and medially they intercross so that the most medial fibers, from the feet and leg, come to lie anteriorly in the medial lemniscus. In the medial lemniscus the body is represented with the head posteriorly and the feet anteriorly. The fibers of lemniscus relay into the corresponding thalamus. Immediately dorsolater al to the cuneate nucleus lies the accessory cuneate nucleus, which receives the more lateral fibers, derived from the cervical segments of the cord, of the fasciculus cuneatus and gives rise to posterior external arcuate fibers conveying proprioceptive impulses to the cerebellum of the same side through inferior cerebellar peduncle. The separated spinal nucleus and tract of trigeminal nerve lies ventrolateral to the cuneate nucleus. The lower part of inferior olivary nucleus is seen. The pyramids lie on either side of the anterior median fissure. The central gray matter contains a hypoglossal nucleus, b dorsal nucleus of vagus, and c nucleus of tractus solitarius. The hypoglossal nucleus occupies the ventromedial position close to the midline in the central gray matter. The dorsal nucleus of vagus lies dorsolateral to the hypoglossal nucleus, and nucleus of tractus solitarius lies just dorsolateral to the dorsal nucleus of vagus. Medial longitudinal bundle lies posterior to the medial lemniscus. It is small compact tract of nerve fibers which interconnect the iliad, IF, VIF, vilith and spinal nucleus of zith cranial nerve nuclei. Spinocerebellar and lateral spinothalamic tracts lie in the anterolateral area of lateral white column. Lateral and anterior spinothalamic tracts are very close to each other and collectively form spinal lemniscus. Transverse section of medulla at the level of olives. Transverse section passes across the floor of the fourth ventricle and through the middle of olives and presents following features, Fig. 8.6. The central gray matter is spread over the floor of the fourth ventricle and contains the nuclei of several cranial nerves. From medial to lateral these are hypoglossal nucleus, nucleus intercalatus, dorsal nucleus of vagus and vestibular nuclei, inferior and medial. The nucleus of tractus solitarius lies ventral to vestibular nuclei. The nucleus ambiguus lies deep within the reticular formation and gives origin to the motor fibers of X, 10th and zith cranial nerves. On either side of midline, paramedian region, from dorsal to ventral lie, medial longitudinal fasciculus, tectospinal tract, medial lemniscus, and pyramidal, corticospinal, tract. The arcuate nuclei, thought to be inferiorly displaced pontine nuclei, are situated on the anteromedial aspect of the pyramid. They receive fibers from the cerebral cortex and send efferent fibers to the cerebellum of the opposite side through the anterior external arcuate fibers. Laterally, from dorsal to ventral lie two prominent structures, a inferior cerebellar peduncle, and b inferior olivary nucleus. 1. The inferior cerebellar peduncle occupies posterolateral part. 2. The inferior olivary nucleus is the largest mass of gray matter, and forms the most prominent feature in the section through upper part of medulla. It presents a crumbled bag-like appearance. Close to the main nucleus lies medial and dorsal accessory olivary nuclei. Transverse section of medulla just inferior to the pons, pontomedullary junction. There are no major changes in the distribution of gray and white matter in this section from that seen in the section of medulla at the level of olives. Only following features are observed. The lateral vestibular nucleus replaces the inferior vestibular nucleus. The cochlear nuclei are now visible. The dorsal and ventral cochlear nuclei lie on the dorsolateral and ventrolateral aspects of the inferior cerebellar peduncle respectively. Blood supply of the medulla. The medulla is supplied by the following arteries. 2 vertebral arteries. Anterior and posterior spinal arteries. Anterior and posterior inferior cerebellar arteries. Basilar artery. Clinical correlation. Vascular disorders of medulla oblongata. The common vascular lesions involving the medulla are the thrombosis of posterior inferior cerebellar and vertebral arteries leading to lateral and medial medulla Y syndromes respectively. Lateral medullary, posterior inferior cerebellar artery, syndrome of Wallenberg. The dorsolateral part of the medulla is supplied by the posterior inferior cerebellar artery, which is usually the branch of the vertebral artery. This artery also supplies the inferior surface of the cerebellum. Thrombosis of posterior inferior cerebellar artery therefore affects a wedge-shaped area on the dorsolateral aspect of medulla, Fig. 8.7, and the inferior surface of the cerebellum and produces following signs and symptoms. Contralateral loss of pain and temperature sensation, in the trunk and limbs, due to involvement of spinothalamic tract. Ipsilateral loss of pain and temperature sensation over the face, due to involvement of the spinal nucleus and tract of trigeminal nerve. Ipsilateral paralysis of muscles of palate, pharynx and larynx due to involvement of nucleus ambiguus. Ipsilateral ataxia, due to involvement of inferior cerebellar peduncle and cerebellum. Giddiness, due to involvement of vestibular nuclei. Horner's syndrome, due to involvement of descending sympathetic pathway in the reticular formation of medulla. Medial immedullary syndrome, Dejerine, S. anterior bulbar syndrome, Fig. 8.7. The paramedian region of the medulla is supplied by the branches of vertebral artery. The vascular involvement, ischemia, of this region produces following signs and symptoms. Contralateral hemiplegia, paralysis of arm and leg, due to damage of pyramid. Ipsilateral paralysis and atrophy of the half of the tongue, due to damage of hypoglossal nerve. Contralateral loss of position and vibration sense due to damage of medial lemniscus. Pons. The pons is the middle part of brainstem and situated between the midbrain and the medulla. It lies in the posterior cranial fossa on the clivus, formed by the fusion of bassi sphenoid and bassi occiput, anterior to the cerebellum. On either side, the pons is continuous as the middle cerebellar peduncle, thus forming a bridge between the two cerebellar hemispheres, hence its name, pons. L pons equals bridge. Is about 2.5 cm long and forms the upper half of the floor of the fourth ventricle. Structurally, the pons consists of gray and white matter containing number of nuclei and fiber tracts respectively. An overview of various structural components of pons and their functions is provided in Table 8.2. Table 8.2. Structural components and functions of the pons. External features. The pons has two surfaces, a ventral and a dorsal, and two borders, a superior and an inferior. Ventral, anterior, surface, Fig. 8.1. Ventral surface is convex in both the directions, i.e., from before backwards and from side to side. It is transversely striated due to underlying pontocerebellar fibers. In the median plane, it presents a vertical groove, the basilar groove, which lodges the basilar artery. The trigeminal nerve is attached to this surface by two roots, a small motor and a large sensory root. The motor root lies medial to the sensory root. A vertical line drawn just lateral to the attachment of sensory root demarcates the junction between the pons and middle cerebellar peduncle. Rostrally, the junction between midbrain and pons is marked by the cerebral peduncles disappearing into the upper part of the pons. Caudally, the pontomedullary junction is marked by a shallow groove. In this groove from medial to lateral, the abducent, vi, facial, vil, nervus intermedius, and vestibulocochlear, vi, nerves emerge. Dorsal, posterior, surface, Fig. 8.3. The dorsal surface of the pons is covered by the cerebellum, and part of the pons. Caudally, the pontomedullary junction is marked by a shallow groove. In this groove from medial to lateral, the abducent, vi, facial, vil, nervus intermedius, and vestibulocochlear, vi, nerves emerge. Dorsal, posterior, surface, Fig. 8.3. The dorsal surface of the pons is covered by the cerebellum, and separated from it by the cavity of the fourth ventricle. The dorsal surface of the pons is triangular in shape and forms the upper part of the floor of the fourth ventricle. For details of features on the dorsal surface of pons, see the floor of fourth ventricle on page 122. Superior border. The cerebral peduncles are attached to this border. The superior cerebellar arteries curve along the border, intervening between the oculomotor and trochlear nerves. Inferior border. The upper end of the medulla is continuous with this border. The anterior inferior cerebellar arteries serve round this border. Internal structure. A cross-section at any level of pons shows two distinct regions, A large ventral or basilar part, and B, a small dorsal or tegmental part. The ventral or basilar part is continuous inferiorly with the pyramids of the medulla and on each side with the middle cerebellar peduncle. The dorsal or tegmental part is a direct upward continuation of the medulla excluding the pyramids. The structure of basilar part is basically the same at all levels of pons, but the structure of tegmental part vary considerably in the upper and lower parts of the pons. Basilar part. This part is composed of the longitudinal bundles of fibers, the transverse fibers, and the pontine nuclei. Longitudinal bundles of fibers include corticopontine, corticonuclear, and corticospinal fibers. The corticopontine fibers relay in the ipsilateral pontine nuclei. The corticonuclear fibers terminate in the contralateral, and to some extent ipsilateral, motor nuclei of the cranial nerves. The corticospinal fibers converge towards the lower part of the pons and form the pyramids of the medulla. Transverse fibers arise in the pontine nuclei and cross to the opposite side to form the middle cerebellar peduncle. These are pontocerebellar fibers. Pontine nuclei are scattered among the longitudinal and transverse fibers. The pontine nuclei form an important part of the cortico-pontocerebellar pathway which connects the cerebral cortex of one side to the cerebellar hemisphere of the opposite side. NB. During development, some of the pontine nuclei got displaced and formed the arcuate nucleus and the pontobulbar body. Tegmental part. The tegmental part is traversed by a number of ascending and descending tracts and contained a decussation of transversely running fibers, the trapezoid body. It also contains the nuclei of trigeminal, V, abducent, Vi, facial, Vi, and vestibulocochlear, VIII, nerves. Since the structures of tegmentum differs in the upper, cranial, and lower, caudal, parts of Th pons, it is studied by examining transverse sections at these two levels. Transverse section through the lower, caudal, part of the pons, Fig. 8.8. Transverse section through the lower caudal part of the pons passes through the facial colliculi. The tegmentum at this level presents following features. Gray matter. The gray matter at this level comprises abducent, V, nerve nucleus, facial, Vi, nerve nucleus, vestibulocochlear, VII, nuclei, and spinal nucleus of trigeminal nerve. The abducent nerve nucleus lies beneath the facial colliculus in the floor of fourth ventricle, just lateral to the medial longitudinal bundle, MLB. The motor nucleus of facial nerve lies ventrolateral to the abducent nucleus. The fibers of facial nerve first wind round the abducent nucleus, producing the facial colliculus, Fig. 8.8, then pass anteriorly between the facial nucleus and the nucleus of the spinal tract of trigeminal nerve. NB. In the early embryogenesis, the motor nucleus of facial nerve is located dorsolateral to the cranial end of abducent nucleus. Thereafter, it migrates caudally along the dorsal surface of that nucleus and then ventromedial to the latter until the facial nerve nucleus reaches its permanent position in close proximity to the spinal nucleus of the trigeminal nerve, a site of maximum sensory stimulus, which establishes quick reflex responses. Such migration of motor nucleus towards the sensory nucleus is known as the neurobiotaxis. Eventually the motor fibers of the facial nerve undergo a loop course, internal genu of facial nerve, around the dorsomedial aspect of the abducent nerve nucleus. The superior salivatory, inferior salivatory and lacrimatory nuclei lie medial to the motor nucleus. Of facial nerve, the nucleus of tractus solitarius lies lateral to the superior salivatory nucleus. The vestibular nuclei lie beneath the vestibular area in the floor of the fourth ventricle. For details see page 122. The dorsal and ventral cochlear nuclei are situated dorsal and ventral to inferior cerebellar peduncle respectively. The spinal nucleus of trigeminal nerve and its tract are located on the anteromedial aspect of the inferior cerebellar peduncle. White matter. The white matter at this level comprises trapezoid body, large long, medial and spinal lemnici, and small short, spinal tract of trigeminal nerve, tracts, medial longitudinal bundle, MLB, and small extrapyramidal and autonomic tracts. The trapezoid body is a trapezium-shaped mass of white fibers lying in the anterior part of the tegmentum, just posterior to the basilar part of the pons. It is formed by the decussation of transversely running fibers arising from the cochlear nuclei of both the sides. The medial lemniscus rotates as it passes from the medulla into the pons, and is situated in the most anterior part of the tegmentum with its long axis running transversely, Fig. 8.8. The medial lemniscus rotates in such a way that the fibers from nucleus cuneatus are medial to those from nucleus gratularis. The somatotopic representation is therefore neck, arm, trunk, and leg, in a medial to lateral sequence. The spinal lemniscus lies lateral to the medial lemniscus and occupies the same peripheral position as in the medulla. The medial longitudinal bundle occupies a paramedian position in the most posterior part. The tectospinal tracts are located ventral to the medial longitudinal bundles. The spinal tract of trigeminal nerve lies lateral and dorsal to the motor nucleus of facial nerve. NB. The lateral lemniscus is not yet formed as a sizable tract. Transverse section through the upper, cranial, part of the pons, Fig. 8.9. Transverse section through the upper part of the pons passes through the trigeminal nuclei. The tegmentum at this level exhibits a small cavity of fourth ventricle, which is bounded dorsolaterally on either side by a superior cerebellar peduncle, and roofed by the superior medullary velum. Gray matter. The gray matter at this level comprises motor and main sensory nuclei of trigeminal nerve. Note that the nuclear components of the abducent, VI, facial, VI, and vestibulocochlear nerves, VIII, are missing at this level. The trapezoid body and nuclei are also not seen at this level. The motor nucleus of trigeminal nerve is situated in the dorsolateral part, beneath the lateral part of the fourth ventricle. The emerging motor fibers travel anteriorly through the substance of the pons and exit on its anterior surface. The principal, main, sensory nucleus of the trigeminal nerve is situated lateral to the motor nucleus, Fig. 8.9. Caudally it is continuous with nucleus of spinal tract trigeminal nerve, and rostrally with the mesencephalic nucleus of trigeminal nerve. NB. The nucleus of locus ceruleus, nucleus pigmentosus pontis, extends from lower part of the midbrain to this level of pons. White matter. The white matter at this level consists of the same ascending tracts as in the lower part. However, the lateral lemniscus is well formed here. The spinal lemniscus lies between the medial and late lemnici. The trigeminal lemniscus consisting of trigeminothalamic fibers is also seen between medial lemniscus and spinal lemniscus. For details, see page 95. Thus, the ventral part of tegmentum, immediately posterior to the basilar part, presents 4 lemnici. From medial to lateral side, these are medial lemniscus, trigeminal lemniscus, spinal lemniscus, and lateral lemniscus. The main structural differences of the tegmentum in the lower and upper parts of the pons are given in Table 8.3. Table 8.3 Main structural differences of tegmentum in the lower and upper parts of the pons. Blood supply of the pons. The pons is supplied by the following arteries. Numerous pontine branches from the basilar artery. Anterior inferior cerebellar artery. Clinical correlation. 1 Gubler syndrome, medial inferior pontine SYNDR. It results from a lesion in the lower part of the pons, which is so placed that it includes the pyramidal tract, the emerging fibers of the abducent and facial nerves, Fig. 8.10. The characteristic features of this syndrome are as follows: ipsilateral medial squint, inward deviation of eye towards the side of lesion, due to involvement of abducent nerve. Ipsilateral facial palsy, due to involvement of facial nerve fibers. Contralateral hemiplegia, due to involvement of corticospinal tract. NB. The term abducent alternating hemiplegia is sometimes used, as there is ipsilateral medial squint and contralateral hemiplegia. Pontocerebellar angle syndrome. The anatomical structures located in the pontocerebellar angle include VIII and VIII cranial nerves, flocculus of cerebellum and choroid plexus of fourth ventricle. The pontocerebellar angle syndrome occurs due to pressure exerted on the lateral region of the caudal part of the pons by acoustic neuroma, a tumor which develops from the Schwann cells surrounding the cochlear nerve near its attachment to the brainstem. The characteristic signs and symptoms are as follows: Fig. 8.10, tinnitus, progressive deafness, and vertigo due to damage of VIII cranial nerve, isolateral ataxia and staggering gait due to compression of cerebellar peduncle. Isolateral lower motor neuron type of facial palsy, due to involvement of facial nerve, isolateral loss of pain and temperature sensation and loss of corneal reflex due to involvement of spinal tract and nucleus of trigeminal nerve. Pontine hemorrhage. The pontine hemorrhage may occur due to involvement of branches of basilar and anterior inferior cerebellar arteries. If the pontine hemorrhage is extensive and bilateral, the patient presents following clinical picture. Pinpoint pupil, due to involvement of ocular sympathetic fibers. Hypopyexia, due to severe damage to pons, the body is cut off from heat-regulating centers in the hypothalamus. Deep coma, due to involvement of reticular formation. Bilateral paralysis of face and limbs, due to involvement of facial nerve nuclei and corticospinal fibers. Tumors. The astrocytoma of the pons is the most common tumor of the brainstem. It usually occurs in childhood. The signs and symptoms depend on the area affected. Midbrain. The midbrain is the upper and shortest part of the brain stem. It is about 2.5 centimeters long and 2.5 centimeters wide. It connects the hindbrain with the forebrain. Its cavity, the cerebral aqueduct of Sylvius, connects the third ventricle with the fourth ventricle. The midbrain passes through the tentorial notch. It is related on each side to the optic tract, parahippocampal gyrus, posterior cerebral artery, and basal vein, anteriorly to the interpeduncular structures, viz., mammillary bodies, tuber cinereum, etc., posteriorly to the splenium of corpus callosum, great cerebral vein, pineal body and posterior ends of right and left thalami. The midbrain, like the other parts of the brainstem, consists of gray and white matter. An overview of various structural components of midbrain and their functions is provided in Table 8.4. Table 8.4 Structural components and functions of the midbrain. External features. Ventral surface. The ventral surface of midbrain presents two crura cerebri which emerges from the cerebral hemispheres and converge downward to enter the pons, forming the posterolateral boundaries of the interpeduncular fossa. The superficial surface of the crus cerebri is finely corrugated by the underlying longitudinal fibers. It is crossed transversely from above downwards by optic tract, posterior cerebral artery, superior cerebellar artery and tinior pontes, while ridge. The oculomotor nerve emerges from a groove on the medial side of the crus cerebri. The trochlear nerve emerges on the dorsal aspect of the midbrain and curls around the lateral aspect of the cerebral peduncle to appear on the ventral aspect of the midbrain lateral to the oculomotor nerve. These two nerves run forward between the posterior cerebral and the superior cerebellar arteries. Dorsal surface. The dorsal surface of the midbrain presents four rounded elevations, two superior and two inferior colliculi, or corpora quadrigemina. The colliculi are separated from each other by a cruciform sulcus. The vertical limb of sulcus, when traced above, forms a surface depression which lodges the pineal body, and when traced below, it becomes continuous with the frenulum veli, a median ridge on the dorsal surface of the superior medullary velum. The trochlear nerves emerges one on each side of the upper part of frenulum veli after decussation in the superior medullary velum. Thick ridges of white matter extending from lateral side of each colliculus constitute their brachia. The superior brachium connect the superior colliculus to the lateral geniculate body and the optic tract, and is made up of optic tract fibers. The inferior brachium connect the inferior colliculus to the medial geniculate body, and is made up of auditory fibers. The superior and inferior colliculi are concerned with reflex activities triggered by auditory and visual impulses respectively. Internal structure. The internal structure of the midbrain is studied conveniently by examining its transverse sections. The transverse section of midbrain shows a tiny canal, called cerebral aqueduct. A coronal plane passing through the aqueduct divides the midbrain into two parts, a small posterior part and large anterior part, Fig. 8.11. The small posterior part is called tectum and consists of four colliculi. The large anterior part is divided into two equal right and left halves by a vertical plane, the cerebral peduncle. Each cerebral peduncle is further subdivided into three parts, from dorsal to ventral. These are a. Tegmentum, b. Substantia nigra, and c. Crus cerebri. The structures in the tectum and tegmentum vary at different levels of the midbrain, but those of the crus cerebri and substantia nigra are nearly the same throughout the length of the midbrain. Crus cerebri, basis pedunculi. The crus cerebri is the part of cerebral peduncle situated anterolateral to the substantia nigra. It contains important descending tracts which connect the cerebral cortex to the anterior horn cells of the spinal cord, cranial nerve nuclei, and pontine nuclei. The corticospinal and corticonuclear fibers, pyramidal tract, occupy the middle two-thirds of the crus. The frontopontine fibers occupy the medial one-sixth of the crus. The temporopontine, paritopontine, and occipitopontine fibers occupy the lateral one-sixth of the crus. Substantia nigra. The substantia nigra is a curved, crescent-shaped, pigmented band of gray matter, thicker medially than laterally, situated between tegmentum and crus cerebri. Its concavity is smooth and directed toward the tegmentum. From its convex margin spiky processes project into the substance of the crus cerebri. The substantia nigra is a large motor nucleus that extends throughout the length of midbrain. It is divided into two parts, The dorsal part, pars compacta, containing medium-sized cells, and b. Aventral part, pars reticularis, containing fewer cells. The pars reticularis is intermingled with the fibers of crus cerebri. The substantia nigra is made up of deeply pigmented nerve cells which contain melanin, a polymerized form of dopamine, and iron. These cells synthesize dopamine, which is carried through their axons, nigrostriatal fibers, to the corpus striatum. Clinical correlation. The degeneration or destruction of substantia nigra causes deficiency of dopamine in the corpus striatum, leading to a clinical condition called Parkinsonism. See clinical correlation on page 159. As mentioned earlier, the structure of tectum and tegmentum vary at different levels, therefore it is again best studied by examining the transverse sections of the midbrain at the following two levels, a. At the level of the inferior colliculi, and b. At the level of superior colliculi. Transverse section of the midbrain at the level of the inferior colliculi. The gray and white matter at this level present following features, Fig. 8.12. Gray matter. The central gray matter around the cerebral aqueduct, contains two nuclei, a. Nucleus of trochlear nerve, and b. Mesencephalic nucleus of trigeminal nerve. 1. The trochlear nerve nucleus is situated close to the median plane, just posterior to the medial longitudinal fasciculus, MLF. The emerging fibers of the trochlear nerve pass laterally and posteriorly around the central gray matter and leave the midbrain just below the inferior colliculi. The fibers of trochlear nerve now decussate in the superior medullary velum and wind round the lateral aspect of the midbrain to enter the lateral wall of cavernous sinus, also see page 190. 2. The mesencephalic nucleus of trigeminal nerve lies in the lateral edge of the central gray matter. It receives proprioceptive impulses from muscles of mastication, teeth, ocular and facial muscles. An ovoid mass of gray matter underneath the inferior colliculus forms the nucleus of inferior colliculus. It receives the afferent fibers of later al lemniscus and gives the efferent fibers to the medial geniculate body through the inferior brachium. Substantia nigra. The reticular formation is smaller than that in the pons and is situated ventrilaterally between the medial lemniscus and the central gray matter. White matter. The decussation of the superior cerebellar peduncles occupies the central part of the tegmentum and forms the most important feature in the lower part of the midbrain. The lemnici are arranged in the form of a curved compact band of white fibers in the ventrilateral part of the tegmentum, lateral to cerebellar decussation and dorsal to the substantia nigra. From medial to lateral side these are medial lemniscus, trigeminal lemniscus, spinal lemniscus, and lateral lemniscus. Strictly speaking, the lateral lemniscus is posterior to the spinal lemniscus and ends into the inferior colliculus. The medial longitudinal fasciculus lies on the side of median plane ventral to the trochlear nerve nucleus. The tectospinal tracts lie ventral to the medial longitudinal fasciculi. The rubrospinal tracts lie ventral to the decussation of the superior cerebellar peduncles. Transverse section of the midbrain at the level of the superior colliculi. The gray and white matter in the midbrain at this level present following features, Fig. 8.13. Gray matter. The central gray matter in each half contains two nuclei, the oculomotor nerve nucleus and mesencephalic nucleus. The oculomotor nucleus lies in the ventromedial part. The nuclei of two sides fuse together forming a single complex having a triangular outline. The oculomotor nuclei are bounded laterally by the medial longitudinal fasciculus. The Edinger-Westphal nucleus, which supplies the sphincter pupillae and ciliary muscle, forms part of the oculomotor nucleus and is located dorsal to the rostral 2/3 of the main oculomotor nucleus. The emerging fibers of oculomotor nerve pass ventrally through the tegmentum intersecting red nucleus and medial part of the substantia nigra, and emerge in the posterior part of interpeduncular fossa through the sulcus on the medial aspect of crus cerebri. The mesencephalic nucleus occupies the same position as in the lower part of the midbrain. The superior colliculus is a flattened mass formed of 7 concentric alternating laminae of white matter and gray matter. Connections of the superior colliculus. The superior colliculus receives afferent fibers from 1. The retinae, mainly the contralator al, through the lateral geniculate body and superior brachium. 2. The spinal cord, pain and tactile fibers, through spinotectal tract. 3. The frontal and occipital visual cortex, conjugate eye movements, and 4. The inferior colliculus. The efferent fibers from superior colliculus form tectospinal and tectobulbar tracts, which are probably responsible for the reflex movements of the eyes, head, and neck in response to visual stimuli. Clinical correlation. Unilateral lesion of the superior colliculus results in relative neglect of the visual stimuli and inability to track moving objects in the contralateral field of vision, although the eye movements are normal. Protectal nucleus is a small group of neurons and lies deep to the supralateral part of the superior colliculus. It receives afferents from the lateral root of the optic tract and gives efferents to the Edinger-Westphal nucleus, the parasympathetic component of the oculomotor nucleus, of the same as well as of the opposite side. The protectal nucleus is an important part of the pathway for pupillary light reflex and consensual light reflex. Its lesion causes Argyll-Robertson pupil in which light reflex is lost but accommodation reflex remains intact. Red nucleus is a cigar-shaped mass of gray matter which appears ovoid in cross-section. It is about 0.5 cm in diameter and situated dorsomedial to the substantia nigra. In the fresh specimen it is red, pink in color due to its high vascular supply and an iron-containing pigment present in the cytoplasm of its cells. Connections of red nucleus, Fig. 8.14. Afferents, cerebellarubral fibers from contralateral dentate nucleus of the cerebellum through superior cerebellar peduncle. B. Corticorubral fibers, mostly from the ipsilateral motor area, area 4 and 6 of frontal cortex. C. Pallidorubral fibers from globus pallidus of the Samnay side. D. Red nucleus also receives fibers from subthalamic nucleus, corpus luisi, hypothalamus, substantia nigra and tectum. Efferents, rubrospinal, rubrobulbar and rubroreticular tracts. The fibers from red nucleus before forming these tracts decussate forming ventral tegmental decussation of phoral. The fibers of rubrospinal tract end in the anterior horn cells of the opposite side. The rubrobulbar tract ends in the motor nuclei of 5th and 12th cranial nerves, also in the nuclei of Illard, 8th and 5th cranial nerves. B. Rubroliveri fibers. C. Rubrothalamic fibers. D. Rubrocerebellar fibers. E. Rubronegral fibers. NB. The red nucleus is considered as an integrating and relay center on the following pathways: A. Cortico-rubrospinal, B. Cortico-rubronuclear, and C. Cerebello-rubrospinal. White matter. Decussation of fibers, tectospinal and tectobulbar tracts, arising from superior colliculi forming dorsal tegmental decussation, of Maynard. Decussation of fibers, rubrospinal tracts, arising from red nuclei forming ventral tegmental decussation, of Forel. Medial longitudinal fasciculus, MLF, lies ventrolateral to the oculomotor nucleus. Tegmentum at this level also contains the same lemnici, i.e. medial, trigeminal and spinal, as those at the level of inferior colliculus except for the lateral lemniscus. The lateral lemniscus is not seen at this level because it terminates in the nucleus of inferior colliculus. Emerging fibers of oculomotor nerve. Medial longitudinal fasciculus. Medial longitudinal fasciculus, MLF, is a heavily myelinated composite tract found in the paramedian plane of the brainstem. It retains its position relative to the central gray matter throughout the midbrain, pons and cranial part of the medulla oblongata. The MLF extends cranially to the interstitial nucleus of Cahill, accessory oculomotor nucleus, located at the junction of midbrain and diencephalon near the rostral end of the cerebral aqueduct, and caudally it becomes continuous with anterior intersegmental fasciculus of the spinal cord. The MLF consists of fibers arising mainly from vestibular nuclei, however, some fibers also arise from nucleus of lateral lemniscus and interstitial nucleus of Cahill. The fibers of MLF interconnect the nuclei of Iid, IF, 5th and 5th cranial nerves and spinal nucleus of accessory nerve. The chief function of MLF is to coordinate the movements of eyes, head and neck in response to stimulation of the vestibulocochlear nerve. MLF syndrome, internuclear ophthalmoplegia, it occurs due to lesion in the upper part of Th. Pons in the region between abducent and oculomotor nuclei. The MLF syndrome is mostly seen in multiple sclerosis and presents following clinical features. 1. Isolates paralysis of medial rectus muscle of eyeball on the side of lesion on attempted lateral gaze. 2. Mononuclear horizontal nystagmus in the adducting eye contralator al to the side of lesion. NB. The convergence and vertical remain unaffected. Blood supply of the midbrain. Arterial supply. The midbrain is supplied by following arteries. Basilar artery through its posterior cerebral and superior cerebellar arteries. Basilar artery also supplies midbrain through direct branches. Branches of posterior communicating and anterior choroidal arteries. Venous drainage. The veins of midbrain drains into the great cerebral and the basal veins. Clinical correlation. Weber's syndrome. Weber's syndrome is produced by a vascular lesion in the basal region of the cerebral peduncle due to occlusion of a branch of the posterior cerebral artery. This lesion involves the oculomotor nerve and the crus cerebri, Fig. 8.16, and produce following important signs and symptoms. Ipsilateral lateral squint, due to involvement of third cranial nerve. Contralateral hemiplegia, due to involvement of corticospinal tract in the crus cerebri. Contralateral paralysis of the lower part of the face and tongue, due to involvement of the corticobulbar tract in the crus cerebri. Drooping of the upper lid, ptosis, due to paralysis of levator palpebrae superioris supplied by oculomotor nerve. Pupil is dilated and fixed to light, and accommodation is lost on the side of lesion due to involvement of parasympathetic component of oculomotor nerve, Edinger-Westphal nucleus. Benedict's syndrome occurs due to the vascular ischemia of the tegmentum of midbrain involving the medial lemniscus, spinal lemniscus, red nucleus, superior cerebellar peduncle and fibers of oculomotor nerve, Fig. 8.16. It is characterized by following signs and symptoms. Ipsilateral lateral squint and ptosis, due to involvement of oculomotor nerve fibers. Contralateral loss of pain and temperature sensation, due to involvement of trigeminal and spinal lemnisci. Contralateral loss of tactile, muscle, joint and vibration sense, due to involvement of medial lemniscus. Contralateral tremors and involuntary movements in the limbs, due to involvement of red nucleus and fibers of superior cerebellar peduncle entering into it. Paranaude syndrome results from a lesion of the superior colliculi as occurs when this area becomes compressed by the tumors of the pineal gland, Fig. 8.16. It is characterized by the loss of upward gaze without affecting the other eye movements. The anatomical basis for this is obscure, but experiments indicate that the area involved may contain a center for upward movements of the eyes. Argyll-Robertson. The Argyll-Robertson's pupil is a clinical condition in which light reflex is lost but the accommodation reflex remains intact. Generally, it occurs because of lesion in the vicinity of protectal nucleus. For details see Chapter 18. Clinical problems. 1. Why brainstem lesions are more dangerous than those of cerebrum and cerebellum. 2. What are the criteria for certification of death in majority of cases, and mention the signs of brainstem death. 3. What is Arnold-Chiari malformation or phenomenon? Explain. 4. What are the presenting symptoms and signs of a patient suffering from posterior inferior cerebellar artery syndrome? 5. What are the signs and symptoms of a pontine hemorrhage patient? Clinical problem solving. 1. The brainstem lesions are more dangerous because they can cause sudden death, as brainstem contains vital centers such as cardiac center, vasomotor center and respiratory center. The damage of relatively large areas of cerebrum and cerebellum do not cause death because they do not contain vital centers. 2. The complete and continuous cessation of the heartbeats and respiration for 5 minutes are the criteria for the certification of death in majority of cases. The language used by doctors is that Mr. X died of cardiorespiratory arrest. But nowadays these functions can be maintained for years by using cardioresuscitatory measures and artificial ventilators even after the irreversible brain death. Therefore, the criteria for certifying a death in such cases have been redefined. Since brainstem death is irreversible and incompatible with life due to involvement of cardiac and respiratory centers, the following signs of brainstem death have universally been accepted as signs of death in patients who have been kept on artificial life-supporting system. Absence of pupillary light reflex. Absence of corneal blink reflex. Absence of conjugate deviation of the eyes when the head is gently but fully rotated to the other side. Absence of eyeball movements when ice-cold water, 50 ml, is poured into either external auditory meatus for 30 seconds. Absence of any kind of motor response to pressure on the supraorbital margins. Absence of gag reflex and cough reflex following stimulation of the soft palate and larynx by suction catheter. If all the above signs are present, elicited independently by 2 clinicians, in addition to the cessation of the heartbeats and respiration, the death can be declared safely in patients who are kept on life-supporting measures. 3. The Arnold-Chiari malformation is a congenital anomaly characterized by herniation of cerebellar tonsils and medulla oblongata through the foramen magnum into the vertebral canal. This results in the blockage of the openings in the roof of fourth ventricle, preventing flow of CSF from ventricular system into the subarachnoid space, producing internal hydrocephalus. B. Lengthening of last 4 cranial nerves due to downward displacement of the medulla oblongata. 4. See page 78. 5. See page 82.